Robert Galarowicz here, naturopath, nutritionist, and kidney disease sufferer, and want to talk about uric acid and kidney disease. So uric acid is a breakdown product that comes from protein digestion, and if uric acid builds up in the body, it can further accelerate the loss of kidney function. Now the kidneys do have a role in regulating the uric acid content, so this is something that you definitely should have tested if you have kidney disease. So even though my expertise and training is in diet and natural therapies for the kidney, I'm going to be talking about a medication because I'm for whatever is going to help you in the best way possible to avoid kidney failure and dialysis. So what's the first thing you want to do? The first thing you want to do is when you go to your doctor, you want to ask for a uric acid test, okay? So get your uric acid tested. Don't assume that it's getting tested. Never assume anything, okay? When it comes to your health care. Ask for it, make sure it's there, and see it in the lab work, okay? Because a lot of people always tell me, well, I think it's okay because my doctor didn't say anything, and then I find out they never even tested for it. Because this is still something that's, it's just getting published in the major research now. I've been reading this research about uric acid lowering therapies and kidney disease for quite a long time, but it's now just starting to become more common among nephrologists, but it's still quite a ways from becoming common standard practice. So first thing you do is get your uric acid tested. If it's out of range, you definitely want to consider a uric acid lowering therapy. Now, what some of the research is cited with lab reference ranges can be different. Okay, so meaning one lab, their upper limit can be 7.5, so anything above 7.5 is considered out of range. On another lab, it can be 9, so anything above 9 is considered out of range. On another lab, it can be 8.5, and I've seen this too. So get your uric acid tested. If it's high, begin a uric acid lowering therapy. Even if it's 7 or above, you should consider uric acid lowering therapy, even if you don't have any symptoms and you're not out of range. So I'm going to read you a little passage from a recent medical text that came out, the 2018 edition of the National Kidney Foundation's Primer on Kidney Disease. And the little passage I'm going to read you is about uric acid lowering therapy, and here we go. Even within the normal range, higher UA, uric acid, appears to exert deleterious effects on blood pressure and kidney function. Experimental work suggests that pharmacological lowering of UA with xanthine oxidase inhibitors like allopurinol and febuxostat, which is Uloric, that's generic for Uloric. Here we go. Blocks the RAAS, suppresses inflammation, slows progression of kidney disease, and promotes kidney and cardiovascular protection in patients with CKD and diabetes. So that's from the National Kidney Foundation's Primer on Kidney Disease, something that I've been speaking about, telling my clients to get tested, checked, and begin uric acid lowering therapies because it will help your kidney disease. They're doing big trials with this right now at the National Institute of Health. However, if you have kidney disease like I do, you can't wait years and years before the research is published and this becomes standard care. Now, I've spoken to about 4 to 6 nephrologists on this topic. Only one of them were aware of the research that's come out in the last 5-10 years or so on uric acid lowering therapies on kidney disease. So again, don't assume it. You got to take some degree of control of your health. For more information like this, visit my website, healthykidneyinc.com. Thanks for watching, everyone. And remember, get your uric acid level tested. Thanks. Bye.